Hello, everyone. Welcome to today's class. Today, we're going to be talking about Koch's disease, which is also known as tuberculosis, simplified for nursing students. Now, let's go. What is Koch's disease? Koch's disease is a contagious bacterial infection caused by mycobacterium. Can we see the mycobacterium? Mainly affecting the lungs, look at the lungs, but can also spread to other parts of the body. What are the signs of symptoms? We have persistent cough of more than 2 weeks. Another one, we have hemoptysis, which is whereby the person is coughing out blood. Another one, we have unintentional weight loss. Due to the coughing, the person will not be able to eat, leading to unintentional weight loss. Another, we have pleuritic chest pain. This person, we all know how coughing for like 4 days, we all know how it happens, we all know how it feels. We would feel that pain, but imagine somebody coughing for more than 2 weeks. The person is surely going to be having chest pain. And pleuritic means infection of the pleura, and the pleura is what covers our lungs. So, due to the mycobacterium that is already inside the lungs, this is going to cause infection of the pleura, and the person it leads to chest pain. Another of the signs and symptoms, we have malaise, which is fatigue. Person will just be so tired. So what are the causes? First and foremost, the causes is Mycobacterium tuberculosis. That is what causes Koch's disease, also known as tuberculosis. And this mycobacterium easily spreads. It spreads from an infected person to a non-infected person. And most times, the non-infected person could be having a weak immune system. And how does this spread? It spreads through coughing, sneezing, talking with infected persons, and sharing personal items like spoons and cups. So, what are the medical diagnoses? How would you know that somebody actually has this tuberculosis? How would you know that? How would you confirm your suspicion of somebody having Koch's disease? Number one, sputum test for acid fast bacilli. The person coughs out mucus, which is called sputum, from the lungs into a container. You have to tell the person to bring out mucus from deep down their throat. The sound is actually not pleasant to the ear, but that is what we need for the test. The person should not bring out just spit, which is what is in our mouth, but from within the lungs. And the lab checks it under a special microscope to look for TB germs, which is tuberculosis germs, and those germs are the mycobacterium. Another one we have is the tuberculin skin test, also known as Mantox test. They would put a small amount of tuberculosis protein, which should be injected under your skin subcutaneously, usually on your forearm. So after 2 to 3 days, a health worker checks the area for swelling. If it swells, it may mean you have been exposed to TB germs positive. The swelling, if it is more than 10 mm, because the health worker is actually going to measure it. If it is more than 10 mm, it's very likely the person has been exposed to Mycobacterium tuberculosis. Another form of diagnosis one with tuberculosis, we have chest X-ray. An X-ray picture is taken of the chest. It shows if TB has caused any damage to the lungs, like holes. We all know that holes mean cavities, fluids or cloudy areas. Then another form of diagnosing a patient with Koch's disease is blood test, which is also known as interferon gamma release assays (IGRAs). Wow, it's so long to pronounce. A small amount of the blood is taken and tested in the lab. It checks how your body reacts to TB germs and also helps detect hidden, that means latent TB infection. So now we've talked about medical diagnosis. It's very nice for us to know how the medical doctor diagnosed the patient. Now, what are our nursing diagnosis? We can remember that we had signs and symptoms of Koch's disease, and it's from the signs and symptoms that we nurses actually diagnose our patient. Number one, persistent cough of more than 2 weeks. Now, if this person has been coughing for more than 2 weeks, you should now know that there would be a blockage in the airway clearance. Yes, the person will not be breathing properly. So, would make our nursing diagnosis to be ineffective airway clearance related to secretions and cough. So the patient is coughing a lot and has mucus in the lungs. This makes it hard for air to move in and out properly, and you will notice difficulty breathing, chest tightness, and noisy breath sound. Another of the signs and symptoms that we had talked about was unintentional weight loss. And when somebody is losing weight, you should know that the person will be going into malnutrition. So imbalanced nutrition will diagnose the person with imbalanced nutrition, less than body requirement related to poor appetite. TB patients often lose weight and have no desire to eat, which is anorexia. This leads to weakness, slow healing, and poor body defense. It's actually a lot. Another one we have malaise, which is activity intolerance related to fatigue and weakness, the infection and poor nutrition makes this patient to feel tired even with littlest activity, just like maybe they want to go and bathe, they're already so tired, and you will see shortness of breath, weakness, and the need to rest frequently. The person will just want to be on the bed. The person does not just want to move, like it's stressful for them. So what are the treatments? How do we treat one that has tuberculosis? First and foremost, this treatment actually lasts for a very long time. So we have the anti-TB drugs, first line medication, and this is number one, isoniazid, which is INH. We have rifampicin, we have pyrazinamide, we have ethambutol. Those are the four major drugs that are used for someone that has Koch's disease. Now, there are so many things we have to know concerning these drugs. Number one, isoniazid. When treating somebody with isoniazid, you have to watch out for hepatotoxicity, which is relating to the kidneys, which is relating to the lungs, and peripheral neuropathy. And when somebody is having this kind of neuropathy, you just easily give vitamin B6, which is pyridoxine, to prevent neuropathy. Number two, when we are treating someone with rifampicin actually turns the body fluid orange and reduces effectiveness of oral contraceptives. So if you are treating someone with rifampicin and the person maybe calls you, nurse, doctor, please, I went to the toilet and I found out that my urine is red. Does it mean that I'm bleeding? Just ask the person, are you taking rifampicin? If the person says yes, tell the person that that is an effect of rifampicin. It turns your body fluid orange or red. Another one is pyrazinamide, PZA. It actually causes hepatotoxicity, so you have to monitor liver enzymes, and it also increases uric acid. So you have to watch out for gout symptoms. We'll be having a class on gout soon. Then ethambutol. We have to watch for optic neuritis, which is the inflammation of the eye nerves, and the person has to report for vision changes whenever this happens. So how does somebody that is a TB patient take their drugs? This person actually has to take their drug under the eyes of a nurse or a healthcare provider or a healthcare worker, I mean. That is dot directly observed therapy. You as a nurse, you actually have to watch the patient take this medicine, and they should not skip it for not even a day. The person has to be watched like an owl. Your eyes should be on that person while the person is taking their drugs. And then with all these drugs and directly observed therapy, how do we now give supportive care to this patient? Nutritional support. If we can remember, we talked about malaise, which is activity intolerance and unintentional weight loss. So we have to actually help the person to eat well, rest and good hygiene, somebody that is always tired, isolation during early stage. Yes, somebody that was actually diagnosed of TB, the person will be put into isolation for a few days during the early stage, and the person will be put on treatment ASAP with anti-TB drugs. Then we have follow-up testing to monitor recovery. Yes, even after the person may have been done taking their DOT, the person actually has to be doing follow-up testings in order to continue monitoring recovery. So I hope you did enjoy the class. We'll be having an NCLEX focused tips for nursing students about Koch's disease. So see you in the next video. Bye.